Can we meet you, sir? Your name and designation.
Oh, thanks. My name is Dr. Ashar Adam Abubakar, the Governance Coordination and Subnational Engagement Lead at the SWAP Coordination Office.
My name is Dr. Evaristos Chijeke Anyako. I'm a Deputy Director. I'm the Head Subnational Readiness Strengthening, Nigeria Center for Disease Control, NCDC.
I'm Dr. Yewande Olaifa. I'm a Deputy Director. I work for the National Agency for the Control of AIDS, NACA. The agency is responsible for the multi-sectoral coordination of the HIV response in Nigeria.
Can you tell us a brief history about what this very important document is all about?
We know that the Nigerian health sector has a lot of challenges. Part of it, issues of financing, and not just the availability of the financing, but how well that financing is being used to address the essential health services. So much so that other countries that do not spend as much as we do have much better health outcomes. To layer onto that is the enormous fragmentation that we have within the health sector. And so within this premise, when the coordinating Minister of Health came on board about a year plus ago, felt that for us to get the result that we want, we need to change the way we approach health sector. And so part of those approaches is having the Nigerian Health Sector Renewal Investment Initiative that aims to use the sector-wide approach as a vehicle to amplifying overall population health outcomes.
In your professional opinion, would you say that this document will be effective in addressing issues relating to emergency preparedness and response?
This document, specifically, DLI 9, has addressed the issues of emergency preparedness and response, by incentivizing the strengthening of subnational emergency preparedness and response.
This project is actually looking at how we can revamp the primary health care level, increase the quality and scope of services. So that's why I say it's actually an opportunity for us to use this funding to increase the coverage when we see donor resources not able to expand their coverage, but even reducing as the case may be.
Have you noticed any gray areas so far?
I think for sustainability, I look at some part of the plan, and the sustainability component of this plan are clear, but also this plan is also hinged on digitization, and I think having some discussions looking at how digitization and ensuring that we have the appropriate ICT infrastructure in the primary healthcare centers is really important to enabling us achieve our goal. I think it's something we also look at, digitizing our primary healthcare centers and our health system to ensure that health information exchange will require some considerable amount of investments, which I think we should look at as a country and as a program too. Yeah.
The team that's really propelled this, I would describe them as subject matter experts. The disparities are just feared, but not any significant disparity. In terms of emergency preparedness and response, it was a very sound document, and the other colleagues are equally, testifying that the document is good.
I think, I know it's a project, but I think this might also be something which we look at to see how, even though we're covering like 2,000 facilities, how do we expand with our own government resources, something like this to all the other primary healthcare facilities, so that we're not entirely donor dependent, but we're actually owning and actually improving the quality of services. Primary healthcare is actually supposed to be the first point of call for any person in the community, and somehow or other over the years we've not really invested the way we should have in the past, and it's only in this last half a decade that we're doing that. The opportunities are there. This is, I'm looking at this as a catalyst again into that area of the health sector with the hope that it will just expand and actually improve our indices with respect to maternal and child health.
Are you satisfied with the content?
Very satisfied with the content, especially within my own chapter, which is emergency medical services. We are to ensure the availability of emergency medical transport for pregnant women and neonates within the communities. So it gives us the opportunity to explore innovations we have in deploying such services to the needed population in Nigeria.
What should the general public and also the stakeholders invited to this very important meeting be expecting after this meeting?
All the stakeholders that should be on board are here today, and that means that everybody, at the end of this, we expect that everybody will be on the same page, and when that happens, we expect a more seamless implementation with states being able to achieve the disbursement linked indicators for which they will be rewarded. The main goal is to save lives and to improve financial burden, and not just physical and financial pain. And of course, this is premised on 4 pillars. The 4 pillars are around effective governance, which will ensure that, of course, governance being the fulcrum of everything that is going to happen. And then also around efficient and equitable quality health systems. And the 3rd pillar is around unlocking the value chains, around which we will ensure that improving local manufacturing for the health system, plugging the gaps. And then the last pillar is around health security, where we try to improve the prevention, promotion, response to public health emergencies.
Most of the important thing is, how do you get that qualitative healthcare service? That's one. Secondly, how do you change the health-seeking behavior of the targeted population, specifically the poor and the vulnerable, so that they can be coming into the healthcare facilities to access healthcare service whenever the need arises. So this blueprint has targeted all these things. Specifically, when you look at the DLIs, you come to realize that there are very important aspects that have been considered in making sure that the healthcare delivery system gets to work at the right time.
There are a couple of things, right? So this developing the POM is one of the effectiveness conditions to make sure that this project comes to life, so that states can begin to draw down from this. When you look at the DLIs, whether from the Hub Health, Hub Gov, there are some of those that as early as end of first quarter of 2025, states can, once the IVAs are in place, states can begin to get their incentives if they achieve them. Of course, we know that at different levels of the state, so far we have about 32 states that have expressed interest to be part of the whole project. And so for them, it's trying to make sure that now they're also putting everything ready to just hit the ground running. They have their budgets, budgets are aligned with their annual operational plans, and now most budgets are passed, so it's now trying to organize and deliver. But from our own end, as the SWAP Coordination Office, states and all stakeholders should be rest assured of our readiness to provide the requisite leadership and technical support to everyone within this space to make sure that we are moving together, because it is to our advantage to make sure that the whole country moves, not just one or two, but the whole country moves in the right direction. So that leadership would come from us, and we will do all that we can to make sure that we fast track the effectiveness conditions, so that as soon as that is done, states that already have merited getting some rewards can have their rewards and can now reinvest them within the health sector to continue improving their health outcomes.
Thank you so very much for the wonderful contributions.
Thank you. It's my pleasure.
Thank you, sir.